my name is Diana Roth. I work at Emory University. Just a little aside before I start, this was the PCORI grant Dr. Krishnamurti received. He moved from Emory to Yale about 6 months ago. But we're still working with the decision aid. So it's called sickleoptions.org. That's the URL address. We created this in partnership with the community, warriors, family members, physicians, other healthcare providers, stakeholders. So we went to a lot of people to talk about decisional needs, treatment options, shared decision-making, and partnership, and see what they wanted in a decision aid. What happens with shared decision-making, which is the goal of this decision aid? You put in a physician's expertise. He or she should know about the decision that's being made medically. They should bring into it the best research evidence. And the patient brings the most important part. They bring their values and expectations. So what's important to them, health-wise, family-wise, society-wise, what they expect from the treatment. So what did we learn? We learned that it had to be easy to read because we wanted adolescents and adults to be able to understand it. And we didn't want any educational barriers in the understanding. It had to include research, the best and the newest research, because it needed to be based on fact. We wanted to make it visual. They wanted testimonials from other patients and people, physicians, different people who have expertise in the field and can talk about personal experiences. And it had to be user-friendly. Otherwise, it was just going to sit there. So what did we come up with? Well, we come up with what we thought was a pretty good first draft. What we did initially to create it is we went to conferences, we interviewed people, asked them what they wanted in a decision aid. And based on that, we developed a decision aid. We went back to these conferences and said, this is what we figured out from what you told us. And we showed it to them, stakeholders, warriors, healthcare providers, anyone involved with sickle cell disease. And they said, you know, you did okay, but there's a lot that needs fixed. So we took notes on everything that needed fixed. We worked on that and worked to make it better. And this is what we come up with. So again, I said it's sickleoptions.org. When you first get on, you see scrolling of different people with sickle cell disease, different ethnic backgrounds and things. And it's all in English. However, there is also a Spanish version that you can click on if you want it in Spanish. So it tells you what it provides, and it provides information about the disease as well as about treatment options. So when you first get on, you see these decision-making steps. Bottom step, let's talk about sickle cell disease. People said that they know about sickle cell disease, but people new to the disease and need to learn about it. Also, some people need refreshers, and some people do have misinformation, so they wanted accurate information about the disease itself. They wanted to know the treatment options. In addition to standard care, which is just seeing the patient and treating the symptoms, they wanted to know what could be done with medication, bone marrow transplant, different things that could be done. They wanted to talk about what's important to me. And they wanted to know how to make a good decision and how to evaluate that decision. So we broke down the first part about sickle cell disease into heredity, newborn screening, birth control and pregnancy, sickle cell disease and usual care, psychological care, and caring for yourself at home. So you click on any of these and you're going to find that information about that topic. So when you click on sickle cell disease and usual care, this is what you see. You can go to heredity or newborn screening or whatever from here. But when we get down to when we get down to sickle cell disease and usual care, it talks about anemia, delayed growth in children, yellowing of the eyes, etc. This particular one talks about kidney disease. It reminds you the damage to the kidneys can start in childhood and gives you some statistics about how many people, 61 out of every 100 adults age 18 to 30, have protein in the urine. That increases to 79% over the age of 40. Indications of protein, our protein can indicate kidney damage. And end-stage kidney damage in adults is a problem. Kidney function, only 15% is barely able to function. So we talk about different things. Now, one thing you see is a blue bar across here. If you don't want to read it, you can actually play that and someone will read it to you. On all of these different pages, we have purple boxes. And it asks if you have any kidney damage. And you can select an answer for that. And I'll show you why a little later. At the bottom, you can go to infection, you can go to eye damage, so you can go to the page before, the page after. When you get to treatments, chronic blood transfusion, hydroxyurea, bone marrow transplantation, and DARI, Adavico, I can't pronounce that, and Oxbrida. We have all of those things in there. So you can click on any one of these treatment options and find out more about it. What do you see when you click on the treatment option? This one is hydroxyurea, and it talks about it. We have a little video about hydroxyurea. We show pictures of the pills or the capsules to show what they look like. We have little tidbits of information in yellow boxes, like it's available in pill and liquid form and usually covered by insurance, to answer some pertinent concerns to patients. When you get to bone marrow transplant, all of the treatment options are set up the same way. They have a set of steps. Bone marrow transplant talks about how does a bone marrow transplant work, what are the risks and benefits, who should consider it, getting a bone marrow transplant, and how it will affect me. So all of the treatments have the same set of steps about that specific treatment. And you can click on any step and learn that information. So this is the timeline off hydroxyurea. At 4 weeks to 3 months, it tells you about the fetal hemoglobin levels. 3 to 6 months, 1 year, and when taken is ordered by the doctor. There's information, other information that we pulled in from different medical facilities, and you can click on that where it says learn more below that box. You can click on that to learn more and connect to other websites that are medical and give you more information. We couldn't put everything into this decision aid. We wanted to give you the option, though, of getting additional information. So when you go to videos, there is a whole video section. And when you go to videos, this little girl had a bone marrow transplant when she was 17, and she is now, oh God, she's probably about 30 now. Her sister just had, about 3 years ago, just had a gene therapy because she didn't have a match for bone marrow transplant, and she is doing very well. So you can click on different videos. Do I have a match, preparing for transplant, all these different things, and they'll show different videos that show up. So with bone marrow transplant, how does bone marrow transplant work? So we talk about that. We ask if you have a donor. Again, these purple questions, I'll tell you why. There's videos connected to this. And I talked about unhealthy bone marrow being removed with chemotherapy and bone marrow stem cells, and talks about the whole process. The reason for the purple boxes is you can, when you come to the end of a section, you can look at this and evaluate, do you have organ damage? Do you have quality of life? How's it been affected? Have you ever been depressed? You can evaluate all of these. You can pull this up. When you first get onto the website, there's a place on the right bottom that you can create an account. You can save all of this and pull it up and talk to the doctor. I do have organ damage. What's the best treatment for me considering I have organ damage? I don't want to go on like I am right now. My quality of life has been affected. I want a treatment that improves my quality of life. Have I ever been depressed? I'm not sure. Maybe yes, maybe no. We can talk about that. So you can talk with your doctor about all of these different things, work in a shared decision-making fashion to come up with the best treatment option. And you already have evaluated those treatment options because you went through this website and looked for yourself to see what you wanted. And if you're not sure about something, you can always go back and check it out again. When you come to comparing, you can compare like usual care and hydroxyurea. I'm getting usual care. The doctor wants to start hydroxyurea. What are the pros and cons of those two things compared together? So I select two things and I can compare them. And I can look at family finances, psychological health, physical appearance, fertility, physical health, all these different things that are important values. And this is what the participant or the patient or warrior brings in, is their personal values and preferences and social responsibilities. So family finances is very important. Bone marrow transplant does greatly impact family finances, so that's something that you would want to consider if you were considering bone marrow transplant. Physical appearance, psychological health, social issues, healthcare needs, fertility. Fertility is a big issue in sickle cell disease, with or without a bone marrow transplant. So you can compare all of these things and see what's most important to you. And when you compare them, like this one is usual care and hydroxyurea, it gives you personal costs. It tells you what kind of things you deal with usual care, what kinds of things you deal with hydroxyurea. Insurance, work, finance, family finances, all of these different things. You can compare usual care to hydroxyurea, or you can compare hydroxyurea to bone marrow transplant, whatever you want to look at. Then we come to making a decision. So how do you make a decision? And remember, this is a shared decision with your physician. You first evaluate with this website what you're considering, what you should consider, what all the treatment options are, and then you take that information to the doctor. Now you'll notice right above, you can see just the edge of a picture here from a video. There's a little gray button that says save. If you're registered and have an account on this website, you can save this information and then quickly pull it up in the doctor's office to discuss specific issues about treatment. And those save buttons are on every page. We had students, undergraduate students, who were helping to put together this website. And they decided they liked this so much, they wanted to create a video of their own to educate people. And so they created a video, how should I prepare to talk to my doctor? So this gives some very good information about getting ready to talk to your doctor and what you should talk about and how you should prepare questions and how you should approach the conversation. So then we come down to reflect on yourself. You're going to talk about your health, what you need to know about sickle cell disease, what do you want to know about chronic transfusions, your beliefs, your family and friends. Again, a lot of this is values. So when you click these open, you can see where we talk about your health and you reflect on yourself. And this is where those purple boxes help you figure that out too. But again, the biggest thing about making a decision is knowing your own personal values and preferences and your own needs. And this website is really geared towards that. It gives you all the medical, but it helps guide you through your values so that you know what is or is not going to work for you. And you can evaluate. Do you understand why you must get a blood transfusion about once every month? So if you have chronic blood transfusions, you can type in here information that you want to talk to your doctor about, and you can go into the office. And again, you can save this page. So you can go into the office, pull up this page and talk to your doctor about this information and have these questions typed in here already that you want to ask the doctor, because you don't know why you have to get a blood transfusion once a month, or you want to know if there's something else you can do besides a once a month blood transfusion. So you can write in notes and write in questions and save this and have it ready and prepared to talk to your doctor. Then you can evaluate your decision. So after you started hydroxyurea for 2 months, or you've had a bone marrow transplant, or you've done chronic blood transfusions for a couple months, you can come back and evaluate, did you make the right decision? Are you satisfied with the decision? And so this helps you go through some things that you can think about to evaluate that decision. It also has a page like this one that helps you by you writing questions down and answering them, and you can talk to your doctor about it to know if this was the right decision. We talked specifically about shared decision making. You need the patient, the doctor, and the family. You can't do a bone marrow transplant without all three. And social worker and nutritionist and different people will get involved in this too, but it's a healthcare providers, the patient and the family. And so we talk about shared decision making. In this blue box, we tell you what it is, we give you the definition of it. And we give in the yellow boxes, we give you some tips. And you need to think about who you want to include in these conversations. So we give you a list of people you may want to include. And when we get to the action plan, we give you an action plan for bone marrow transplant, for hydroxyurea, for sickle, or for Andari, everything. So every treatment has an action plan, and you can click on the black boxes and it'll open up. And one of the things is you need to plan to be away for a bone marrow transplant. And so it gives you information about, you're going to need emotional support, you're going to need to worry about finances, medical care, other costs, such as lotions and different things. And so this gives you tips. We did not develop this ourselves. This was developed from warriors and their families. They're the ones that told us what is needed in the plan of action for each of these treatments. So this is very much a community-based educational tool. We were able to put in the research because evidence-based practice is so important. But when it comes to values and when it comes to patient needs and family needs, the warriors and the families are the ones that gave us this information. So this is more information about how to evaluate your decision. And here's one specific on hydroxyurea, how to evaluate. You can evaluate the number of episodes you've been having, the number of weeks, months, years, when did the pain start, how long have you been taking the meds, what's the difference between before taking them and after taking them. So everything is set up for evaluation purposes. So this is what you see when you go to your saved page. All those save boxes you want to save and talk to them. You'll see this and you can just pick which one you want to talk to the doctor about. And it'll take you to that specific page without you trying to navigate through the website again. You can also print this stuff out. And here's some videos, and we do have a whole video library, and we have it on various treatments. Now, we don't have the newest drugs yet because we haven't been able to get back out in the field and get some new videos, and those drugs have not been available for that long for us to be able to get the videos yet. But we do have videos on chronic blood transfusion, hydroxyurea, and bone marrow transplant. Now, with the chronic blood transfusion, we not only have warriors who get chronic blood transfusion, we have healthcare providers talk about what the transfusions are and what the differences are between different types of transfusions. So we tried to bring everyone in. We have family members, we have warriors, we have healthcare providers. So there's videos from all kinds of people. So again, I can't stress enough, this website belongs to the community. It was developed by the community, all of their input, and without them, we wouldn't really have anything. So that's my website. Any questions?
So thank you, Diana. This is wonderful. And Dr. Sue was nice enough to put the link for the sickle options in the chat so people can go to that. And that was basically the question asking, is it in development or is it available now?
No, it is available.
And I think you answered the question, you just answered the question about will you be able to update with the new meds? And so will you have the capacity to update with the new meds?
And Dr. Krish is developing his new program up at DL right now, and he'll be able to update eventually with the new meds.
Wonderful, wonderful. Well, this has been wonderful. So thank you again so much, and everybody. We will head on over to the next session. And if you think of further questions, feel free to pop them into Iascnapa on our admin at iascnapa.org, and we will get you the answers. And thank you so much, Diana, for taking the time. And I know this was years and years and years of hard work.
It took us years. We started it in Pittsburgh. We finished it in Emory.
Yeah, yeah. People don't understand how much time and effort goes into these. So
yes, this really took a long time.
Yeah. So thank you for all you've done. And we will, I'm sure you'll get a lot of people going to your website and taking advantage of that. Thank you
for having me.
Thank you. Take care.
I wanted to mention too, there is a way to go in as a visitor without creating an account.
Oh, okay. So
you can go in either way.
Okay, great. Great.
Okay.
Thank you.
All right. Thank you. Bye-bye.
Good seeing you again. Take care.
You
Bye-bye.
too. Bye-bye.